Before we even start the show, I have a big announcement, y'all. We are sponsored.
Guess who got a sponsor, bitch?
Shit, I'm 30 got sponsored.
Who got a sponsor?
Shit, I'm 30 got sponsored.
Hey!
Dexty, let us know who we got sponsored by.
We're sponsored by Audible today, guys. That's right. A legit company.
A real company.
Oh my gosh. Today's podcast is brought to you by Audible, y'all. Get a free audiobook download and 30-day free trial today at www.audibletrial.com/shit-I'm30. Over 180,000 titles to choose from on your iPad, Android, Kindle, or MP3 player.
Hey.
We're doing a beat. Welcome back to the sponsored Shit I'm 30 podcast with your hosts,
Carla
and Dexty.
Today we have a really special guest here.
So excited.
We have a plastic surgeon.
Yes.
In the play. He's not doing anything on me today.
Not today.
Not today. Do you want to introduce yourself?
Hello, my name is Nathan Pham.
It's so nice to meet you, Nathan. We're so excited.
First of all, thank you for coming.
Yes.
I shot the DM and I'm like, I wonder if he's actually going to come. He's probably going to be like, who is this weird girl? Asking me to come on what? What is this? Who are you?
Yeah.
Are they trying to kill me? No, I wasn't trying to kill you.
Yeah, you're so cool for coming.
Yeah, thank you. Thank you.
So, Nathan, tell us a little bit about yourself. How long have you been practicing?
I've been practicing since I was 32. Now 48, so
Okay.
16 years. Yes.
Okay, cool. Is there something that you specialize in?
Body contouring.
Oh.
Body contouring. Y'all
I
hear
feel like
that?
that's like really popular now.
Yes.
Everybody's getting it done.
Yeah.
It because of the social media, Instagram, and
Yeah.
Facebook, and all that. Everybody wants to look like Kim Kardashian or Kylie.
Do they like bring you pictures of them?
Of celebrities?
Really?
Yes.
Wait,
Huh.
so and they bring you Kim and Kylie.
And like some of the Instagram celebrity where they have the really nice big round.
Like the bartenders.
Yeah.
Do you think that Kim's work looks good?
Actually, I can say because I've never seen her in person, so I don't know.
Do you think
So,
the pictures look good?
That's a little too big.
Right.
A little too big for her, right?
The leg,
Yeah.
like the proportion from the leg
Correct.
to the boot. Yeah.
Sometimes she looks like those ants.
Yeah.
She just looks weird.
So when someone comes to you, like, do you just give them what they want, or do you kind of like have to coach them as far as like?
Usually, I ask them what do they have in mind, and I explain to them whether they have realistic expectation or not, because you can only do so much.
Realistic is a real good word to tell them.
Exactly. So,
Okay.
Let's look for the did you pull up the pictures?
Okay. Yeah, we're gonna play a little game with Dr. Nathan. Can I call you Dr. Nathan?
Sure.
It's Dr.
sure.
Pham.
Okay.
We're on first name basis now.
Yeah. So we're gonna play a little game called Guess the Procedure. So we're
Okay.
gonna show him a few celebrities, and he's gonna guess what they've had done. So I'm gonna show him right now Kylie Jenner's face,
You could have showed the whole body, girl.
and this is just a guess.
She had her lips done for sure.
Yeah.
These are the before and after,
Yeah.
and she had her facial contour.
What's a facial contour?
Facial
Is, facial contouring when it's not almost like a B line where you make your face look thinner.
Really?
Yeah, you do it through Botox or like enhance your cheek. It's an optical illusion. You know, like how you put makeup on, you create that.
Like
that
you
shit.
contour with.
Yeah,
I did
exactly.
not know that you can contour
Me neither.
your face with
Fillers?
Botox. And you said
Yeah, like
Botox.
you say, Botox, or you could do liposuction.
lipo
On
in
your
your face.
Yeah, absolutely. Yeah.
That is
I did not know
Yeah,
that you could do that.
I will show you a picture of a friend of mine. She's like a sister. So
Okay, cool.
her before and after, and so you can see the transformation. And
Lipo
this,
on the face.
Oh, look at that one.
the same person.
No way.
Yes.
Get out of here.
See?
Wow. So this lady that we're looking at right now, guys, she has like that kind of like round Asian
Yeah.
face,
Uh-huh.
right?
Yes.
And she has like these chiseled cheeks, not
Yeah.
like.
Now she looks like Kylie.
Yeah.
Wow.
No, she doesn't look like Kylie. She has like a thin face.
Face.
Now, she went from round to thin.
Yeah, I can send you the picture so you can. Yeah.
That is insane. Yeah, we can post it. We'll
Okay.
take her like name off of it.
Yeah.
I'm gonna show him now. Excuse me. Angelina Jolie. This is a big one. No one ever knows if she's ever had anything done. He's
Get
like,
her eyes done, definitely.
Her eyes done?
Yeah. If you look at the excess skin on the before versus the after, it's open up her eyes.
ooh.
Yeah. So And definitely she had fillers.
Like on her
collagen.
face?
Yeah.
Collagen?
Yeah.
What does collagen do?
Okay. As you grow older, you start have more wrinkles, more lines, and this start around mid to late 30s, sometime earlier.
Oh my God! Wait a minute.
Like right around the fold of your
Doc.
mouth. Like for example, these are the lines.
Yeah.
And then you basically put collagen in to fill them up to make you look 5-10 years younger.
Oh, so
Yeah.
we're gonna start getting lines, Dex. We need to start working on this.
Yeah.
So-
So we need to stop
And-
laughing so much. Just relax your face.
Yeah.
Stop having
Yeah,
fun.
some people have Botox, they start early. So I have some patients come in their 20s, and it's prevention.
Do you think for the best results, you need to do it before?
It's good to have prevention, like sunblocks. If you start to have lines that.
What about procedure prevention?
procedure prevention? Well, by the time you have procedure, it's no longer prevention.
Yeah.
Because people say you should get Botox to prevent the lines.
That's fine. Botox and fillers, that's
fine.
prevention.
That's prevention.
But by the time you have procedure like facelift,
Oh.
that's no longer prevention. It's
Yeah.
like, yeah.
You just took care of
Okay,
the
what
problem.
about Kim Zolciak from Real Housewives of Atlanta?
Oh my God, I heard.
Did you hear about that?
She like her lips.
Yo, she has a-
way too big.
Her lips, okay.
Her nose.
Her nose.
Probably her eyes done too. Okay, if you look at this picture, you see how puffy and a lot of the
Yeah.
and then look at the puffiness they're gone.
I didn't know. So her eye. When you say eyes, you're talking about eyelids.
Yeah.
Yeah. The
Her lip.
eyelid.
Oh, you can do
Yeah.
eyelids.
Oh, that's very
You
easy.
know some people have like the little fat in here.
I have it.
Yeah.
No, you don't.
No, you remove it and then it's just.
It's like a little piece of fat, right? I saw
Yeah,
Dr.
skin
Miami
and
do it on
fat. Yeah,
Snapchat.
yeah,
Do you have a
yeah.
Snapchat where you snap your procedures?
I don't,
You
I
don't
don't know how to
snap
use
procedure.
Snapchat. The only social media I have is Instagram.
Oh.
But not for the procedures.
No.
Because you
Sometimes I record them if the patient requests and I show it to them.
So have you seen the ones from Dr. Miami, how he records the whole thing and puts it on social media?
Yes.
Yeah. What do you think about that?
That's fine for him. He's doing really well and he get a lot of clients. But
He does.
but I like
You like the
my
privacy?
patient like privacy. Yeah.
Gotcha.
Yeah.
Gotcha. Yeah, I mean, it's
Yeah,
different.
I wouldn't like my doctor snapping my procedure.
I think that
They consent. They
yeah, they have
to get
consent. Yeah, not all the
Yeah.
people get it.
Yeah.
Consent.
Sometimes my own patient take their own pictures and video during the procedure. And
Oh
that's fine,
wow.
Yeah.
I can't. So actually, since we're talking about what we've all had done, do you want to be completely transparent about what we've had done?
Oh, can you guess what we've had done?
Can you guess what we've had done?
You probably have your breast augmentation. You are natural.
Am I? You
Your
think-
breast? Yeah, they look
Yeah.
natural.
Shout out to my doctor, Dr. Jorge Gonzalez in Winter Park, because honey, these were paid for.
Okay,
But
it
that's-
depends on how you want to look.
Yes,
So,
that
But-
was. I went to so many different consultations. Go ahead.
But I have, you have, what do you have?
Silicone.
Say-
Silicone,
Silicone.
and I have saline.
Saline, yeah.
Yeah.
So silicone, I think personally they're more natural.
Yeah.
Yeah. But some people like saline, some people like silicone. It's
Yeah,
just-
there are some people that want saline.
Yeah.
Why did you get saline?
It was something about like because I'm thinner, like the rippling.
Actually, saline give you more rippling than silicone.
Then I have silicone. Then
Yeah.
I have silicone. Then
Yeah.
You don't know.
I have the one that though it was a newer one that even if it pops,
You
like
have silicone.
it
Oh,
yeah,
yes.
silicone, not
okay,
saline.
okay,
Yeah,
yeah,
silicone.
I have silicone.
Because if it
Yeah.
pops
I
a
have
saline,
silicone.
the water comes out,
Yeah.
right?
Yeah.
Yep.
Yeah.
And
Yeah,
you're-
silicone.
It's like the memory foam. It's like
a memory
It's
gel.
like, yeah, it's
Memory
like,
gel.
that's
Cohesive
exactly
gel,
what I
memory
have.
gel.
Or has that memory
Exactly
foam.
what I
Oh, gummy bear. Oh, gummy
Yeah.
bear.
Tempur-Pedic
Oh,
titties.
Yeah, that's exactly what I have.
Yeah, that one. So can you guess what else we've had? Oh, let me stand up so you can look at
Okay.
me.
Oh,
hold
yeah,
on.
let me
let me
stand
stand. Definitely not no lipo on my gut.
No. I don't know because it's hard to tell when you're in clothes. So yeah, so it's hard. So
What about our face?
probably nothing yet. You guys have to move your eyebrows up. Yeah, you haven't had
Just making
anything.
all kinds
Yeah.
of faces. What about me?
I could say maybe you had your lips done.
Really?
Maybe I don't know because
Really?
yeah, because I could see a little bit of the fullness. You know how you draw on the
Oh my god.
lip liners.
So my lips are natural and I want to get them done.
Yeah, she hasn't
Should
had
I
them
get
done
them?
yet.
Should I not get them done?
It depends on how you want to live. You want to look like
She-
Kylie.
I don't.
She wants her lips done.
I don't want to look like I'm sucking dick all day long.
No, you want to look like that. No, there's a way to do it. You can look super natural.
Yeah, I just wanted it like you know how
Full
they're
edge, yeah.
wrinkled.
Yeah. Oh.
I want that wrinkled, like the
Yeah.
wrinkly stuff to go away.
I see. I
But
checked with
don't-
somebody. She's I'll show you. She just came to me actually early today. She's a friend of mine. She came to my house. So she's have these wrinkles. You see?
Yes, those are the wrinkles I'm talking
and
about.
that's the before.
Okay, show us after for
and
sure.
this is right after.
Oh, right after?
Right after.
So is that swollen though?
It's swollen, but it's still the wrinkles are gone.
Yes, I want my
Okay.
wrinkles to be gone, and I don't want to look like this.
Yeah. No, and it's swollen. But I can show you what they look like a few days later.
So I did have something done on my face though. I had dysport
Oh, yeah.
right here because I have a button, but
Yeah.
I have to get it done again. Obviously.
Yeah,
I have
this
a
sport
button
is
between
good.
my eyebrows.
I like this sport too. I used to like Botox, but I like this sport.
So what's the
more.
difference?
Yeah.
Okay, Botox is the first to come out.
Okay.
So it basically is toxins you inject into the muscle to paralyze the muscle, so you can't move. So you can. It's prevention of wrinkles.
Okay.
Then this sport came out, which is similar product, but it works faster. The next day it works right away. Botox takes 3 to 5 days for it to kick in. This sport works the next day, and duration is basically the same.
Oh, is it? Because
Yeah.
I was told that dysport lasted longer.
The same, yeah,
About the same? But is it cheaper? Which
the
is
same,
cheaper?
really the same price.
Oh.
So-
This was slightly a little bit cheaper, but
So it's like Nike, Adidas,
Coke and Pepsi.
Coke, and
Coke
Pepsi.
came out first, and then Pepsi. So yeah.
And they're
Gotcha.
both just as good. So
Yeah.
you really don't have a reason to choose one over the other.
I
really?
like this sport because it works faster the next day.
Oh, okay.
Okay, so
So-
when you say you do Botox, were we on air when he said he had done?
No.
So he
First
does
of all, his face is flawless.
flawless.
Not
Thank
one
you.
line.
You say you're what 42?
48.
Get the. Listen, we're gonna take
I
a picture
really
with him
thought
because
you were 35.
That's
I'm
what a
not
lot of
just
people think,
complimenting
yeah.
you. I really
He
thought you
loves-
were 35.
amazing.
Thank you.
I need to do whatever he does. He says he does Botox or Dysport.
And this, well,
He does it on his face by
He
himself.
does his own face.
So he sits there in the mirror like we're putting up lipstick, but he's really shooting his face with Dysport or
yeah.
Botox.
Yes.
That is talent right there.
Yeah, that is.
I just started this sport like a month ago, and I love it because I was going to Tampa with a few friends. So I took a selfie in the car, and I saw those wrinkles. I said, like, oh no. So that
You
night I
just-
went home. Yeah, I put it, and the next day I went out, and I took the same picture again the next day, and those wrinkles were gone.
He said my
God,
selfie.
I love it.
I did the same thing.
I love it.
It was
He's-
too
that-
much.
Think about that access. Like,
Yeah.
I got a wrinkle. An hour later, I don't.
No, yeah, I definitely did it. It changed my life. The only thing is when I'm mad, right after like maybe a week later, and I want to show Ayana or Jay that I'm really fucking pissed. I can't. They don't see it in my face. They think I'm playing because I'm like nigga, I'm mad. And my face will be like nigga, I'm mad. So I don't look mad, but I look beautiful.
Yep.
What's the procedure that you do the most?
Most in Florida in my practice right now, because 90% of my patients are Spanish, so liposuction and Brazilian butt lift.
So we like them booties.
And tummy tuck too, yeah.
Tummy tucks?
I can guarantee you nobody can beat me in tummy tuck.
Really? So you were the best tummy tuck out here.
I would say so, and my patient would say so.
So why would you say that your tummy tuck is good?
Because I'm very aggressive, and I'm really aggressive in tightening the muscle and contouring, like shaping of the body.
Oh, so you contour it.
Yeah.
So,
I have
do
a
you give them
technique
abs?
which I use, which I don't want to say because.
Oh, yeah, no, don't say your technique, 'cause they might
Because
steal
I
it.
had a drug rep that came in to try to sell this surgical instrument to me, and then when she saw me doing the procedure, they said, "Wait, you do it differently than other surgeons." And I said, "Yeah."
No, sign an NDA like Beyonce.
Yeah.
Non-disclosure agreement. Don't walk out of here.
So she said, like, wow, she was really impressed. And so she wanted me to give the pictures, send it to her companies to promote it.
Nice.
Oh, cool.
So you have to like, when I've seen it, because
It looks like you're like digging in
Yeah.
them.
Yeah, I can
and
show
then-
you some before and after. So you can.
yes,
Oh,
show
yes,
us
yes,
before and
yes.
after.
And what's most important, the belly button. Because
Yes. We were
Because-
just talking about that on the live. That they look like they're 2
A lot of
inches
times
long.
the belly button looks weird afterwards.
that's 1 month after.
One
That
month?
belly
Let me see.
button looks like a normal belly button.
Oh yeah, that's definitely a normal
1
belly
month.
button. Oh, and before
you're
she was.
really
She,
good.
according to this patient, she sent me the after picture. She says she haven't worn those underwear since the year 2000.
Wow.
So 18 years ago.
But wait a minute. Why the hell she still got the same panties from 2000?
She haven't been wearing
I don't know, but she said she
That's
haven't worn
crazy,
them.
panties that long.
And here's another patient. She sent me the after picture too.
Wow.
Let me see the belly button.
You can blow it up too, like enlarge it.
So how? That's
Yes.
crazy.
Wow,
Because
she got
it's like
curves.
9 times out of 10 the belly button gives
Now
it
you want to
away.
see a patient that's went from a size 12 to a 2?
Get out. Just with
You do
surgery?
that with surgery?
Sitting on a table, no gym.
I can send you a text message too.
Yo.
That's crazy.
Okay, Doc.
So now I do have a question about liposuction and tummy tucks. I heard that like if you get it right and you gain weight back, you don't gain weight there anymore.
Correct. You have a fixed number of fat cell. Let's say you have a fixed number of fat cell on your love handle, and you suck out the love handles. So let's say you remove most of those cells. The one that left behind, they still can grow, but a little bit. But you have a lot more fat cells somewhere else, like in your butt, your breast, your arms. So when you gain weight, those cells, there are more cells there, so they grow bigger there.
But why is there more cells there now? They increase?
No, because you suck out the one in the love handle, so those are gone.
It's a lower number there now, and the other ones still have that high number.
So the other ones are gonna get more of the fat.
The fat cells don't multiply. They get 5-10 times its own size.
Wow.
It's like a balloon that keeps expanding.
Oh, that makes sense.
So if you gain weight afterwards, you can look weird.
Yes,
so you gotta
correct.
like maintain it.
Yes, maintain it.
Yeah.
Or you can come back and have the other areas done. Which I've seen a lot of people do. Yeah.
Just come back.
And so I didn't know you could lipo your face.
Yeah.
Like so you can literally lipo almost everything.
Well, my motto is if you can pinch it, I can suck it.
Oh, so ask them about your armpit boob.
Yes.
Absolutely.
Yeah, like
how does that work?
I call it an arm vagina.
Oh, you know what? You have some fat there, but that is the new thing that just came out. It's not FDA approved it's called Kybella. It's for the chin.
Yes. That's not FDA approved?
No, it's FDA approved for the chin, but not for that. But you can use it off label because there's nothing you can damage there. So, but they don't recommend like on your face because then there's a lot of nerves on your face that can.
So what is Kybella? Because I've heard that's the thing that you remember you were talking about right here.
Kybella is a substance that you inject into the fat to kill the fat cell. It's like mesotherapy a long time ago, but meso was not approved.
So do you put it in the stomach?
People I heard in New York City that do it to do like etch out your muscle to do like a 6-pack. But it's very expensive though. So
have you ever done a faux 6-pack, like a fake 6-pack?
Oh yeah, sure.
Yeah.
I call it abdominal etching. I can do it if you already have muscle, but if you don't have muscle, you can't create what you don't have. So I'll give you an example. I have a lady. She works out a lot, and so she had good muscle, but she had a thin layer of fat above that. So she came in and she wanted to remove the little pocket of fat, and I recommended, hey, why don't I do your abdominal etching for you?
Yeah.
So this is the before and after.
Wow.
And those are her muscles.
Yeah, those are her muscles.
So she just removed the fat on top of it.
So why wasn't it showing before?
Because she had a layer of fat.
No, because layer of fat on that. So
and how do we get rid of that layer of fat?
You see,
but
you see all those lines?
Surgery.
Without surgery, then you just have to be very on lean diet and
extremely
exercise.
Lean. Probably like 0
So that's why mine don't show.
Exactly. I'm sure you have there so you can edge it out. So
they're there. I feel them. Like the 2 top ones come out, but the rest are just covered.
But some doctors just like make them on fat. It look like I've seen.
Yeah, it looks
like,
it doesn't look good.
So bad.
Yeah.
It's like you fat, but you got abs.
I'll show you another picture of a
I feel like
guy.
they do that a lot in Colombia.
I saw some men like that.
See this? I'll show you. This guy. He always had like nice abdominal muscle. You see?
Oh,
yeah.
But they're not defined. They're not defined.
Right.
Okay.
So what I did, I make them more defined, stand out, etch them out. So this
so what
is
did you do?
After.
Girl, we would not know that man got his body done.
Let me see.
We were just talking
This
about
is after.
that.
So it's still his muscle, but it's just more defined.
These dudes out here at the gym and at the beach, and he did their abs.
I would not know.
So
that is insane.
I would not know.
We wouldn't know, so we'd be out here with these dudes.
But to get good results like that, you have to already basically have abs.
Okay,
Correct.
he already had abs.
Yeah.
I get it.
That's
wow.
really
Let me see that
cool.
picture. I'm gonna show it real quick.
So, what's your most requested procedure? Is it the
right now, liposuction.
liposuction?
Lipo
Is it just lipo or is
Love
it
handles.
fat transfer?
With that,
love
Brazilian butt
handles
lift.
taken out.
I'll show you an example
Yes, show us.
of the.
Is there like and I don't even know if you can like answer this. Is there a certain amount of weight you have to be able to transfer fat to your butt?
Well, if you have enough fat, I have to examine the patient. That's why I
How about this? Look at this fat right here.
Can she put that in her
Can
butt?
I put that in my ass?
That's not enough. You need more.
What about both arms?
Yeah, both.
This is an example of Brazilian butt lift. What I did was I took the fat out of her love handles and her bra areas, and I reshaped it into her butt. So you can
Nice.
so.
Booty. So those lumps that are there go away like after with time,
Correct.
right?
Yes.
And it's
Massage.
smooth.
We massage it. Yes.
Oh,
Okay,
yeah.
massage.
Here, I'll show you somebody after about a few months. Okay.
Okay.
This is after about 2 or 3 months.
Let me see. Oh, that looks so real.
Yeah,
That looks
it's all
so
fat, it's all body.
real.
That
Yeah.
looks so natural.
Doc, stop, because I'm over here trying to buy like investment property. I'm about to invest on this ass. Okay.
So speaking of booties, though, so you said that you can transfer the fat. What about like injections in your butt? Is there a safe way to do that yet?
Injection
So like,
what?
let's say you don't have enough fat and you want a butt.
Okay.
How is there any way to do that?
There it is. There are people doing that. It's off-label use. If you can get good quality medical grade silicone.
Oh,
Yes.
real quick, I have on live one of your patients,
Okay,
Gabby.
Gabby. Oh yeah, I know Gabby.
Yeah.
Oh, really? Look
She
at
loves
Gabby.
it.
It sounds like Dr. Pham, and I said, and she goes, "Tell him I said hi. I'm about to do his lips and Botox on Thursday."
She is. Yeah. She loves me.
So you're her lip doctor.
Yes.
That is so
Oh,
funny.
tomorrow. Yeah.
So
Okay,
you're
so
saying there is a way that you can get your butt. So it's
If
injections.
you're like extremely skinny and you have no other option.
So like her.
Yes. And then there's some people that you can find.
Right.
I think in New York City. I'm not sure.
So
but
there's
they can-
certified doctors who could do it, not
Yeah.
just like
because
some
you have
back
to sign a
alley.
waiver form.
Oh,
Because
okay.
it's off-label use. Anything
Okay.
off-label use.
So what about, you know that Dr. Simon Orion or the Kardashians doctor in LA?
Uh-huh.
He, like, Kylie doesn't have fat to transfer.
Yeah. So they might have done that, but it's like, no, not official. Like I'm sure a lot of people have it done. Like in South America, a lot of movie star actors have silicone injection. It's legal in Europe. If you look at silicone injection, but not in
Are
the
there
US.
good doctors in Europe?
That I don't know. I can't say. But the people are doing stuff in Europe and Asia.
I feel like medicine
Do you-
goes faster in Europe.
Do
They
you think
approve 'em.
that will eventually be like, why? Like, is there a reason they're not approving it?
Because the American, a lot of lawsuits. Let's say you had something done and there's no correlation between it, but you still can sue the doctor or whatever. So,
okay.
Even though you sign a waiver, you still liable.
Right.
Yeah.
Yeah, I feel like people here sue for everything, especially doctors. They get stuff done.
That's why in
super
South
quick.
America and Europe and Asia you can get things done. But it depends. You know, there's risk involved with everything you do. So.
Right. Yeah.
Is there a risk in labiaplasty?
No, I do tons of those.
No way.
Yeah.
It's pictures of
It's very
labiaplasty.
simple. You can do it. You can do it under local anesthesia, in and out. And you can
Okay,
work
but
it.
what is labiaplasty for?
Okay. Some young ladies, some that are like 12, 13, some are 20s, and some women after childbirth. What happened to the labia, the lips, they're hanging. They're like
But not
long.
the main one, the inside one.
Inside.
Okay.
Yeah, the labia majora is the big lips on the outside. And
Okay.
the minor is the smaller lips on the inside. They're very loose, they're hanging. That could be after childbirth or good hormones. They have
But can you be born that way?
Yes, sub 13, 14. Like some little girls, sometimes they play with it because they...
But wait, you've done it on a 12 or 13-year-old?
No, he's just saying-
Yeah, they
Oh.
can have it. So they
Gotcha,
get
gotcha.
embarrassed in gym class or whatever because they have it and nobody else.
Okay.
And I had mom brought in that 15, 16 years old. And yeah, this is an example.
So that's before.
That's
Before.
before.
Okay.
What is that thing?
She had a period, so she.
Oh.
Oh, yeah, I know.
I
With
thought
a
it was-
tampon, I know. So that's the
Okay, so
before.
that's before. It looks like a porn star's vagina.
Wow.
Exactly.
Wow.
Yeah.
It's gone.
Yes.
So what happened to all of it?
You cut it out completely, and you have no scar.
So let me see the
Do you
before
still
one.
have full sensation?
Full sensation because you don't.
Because I don't have those, but it's always... I didn't know they cut the whole thing
Yeah, out
out.
completely. I've
And
done
you,
so
and
many.
you don't lose any sensation.
Full sensation.
It's like a
Because your
toast.
sensation mostly from the clitoris and also the vaginal wall. But it's actually just skin. Think of that as the scrotum, skin of the scrotum.
Oh,
on the
okay.
men.
So when,
Yeah.
gotcha. When they're circumcised.
Yeah.
So it's like a
yeah.
circumcision.
Yep.
Is that like a popular procedure?
It is. A lot of people do it that they don't tell.
Yeah.
They don't let
Oh.
people know.
Wow.
So is the recovery is not that bad?
No, it's easy.
That's just an
Yeah.
outpatient. Like you come in for Botox. Come in and
it's
get
like,
your lips swiped
it's like
off.
you can go back to work the next day. Really.
So what's the
Wow.
most expensive procedure?
It depends. It depends on the location. Like here, you can get breast augmentation. I have patients who went to Miami who
Like
get a breast augmentation.
2,300, right?
Yeah,
Yeah.
3,000 here.
Yeah.
The cheapest is 45 or 5,000.
Yeah.
And it can go. It depends. I have heard the people in California and New York they pay 10 to 12,000 for
Yes,
breast
I've heard of
augmentation.
For
those too.
titties?
Yeah.
Wow.
So,
$10,000 teeth, they better just walk around shaking.
It depends on competition too. You know, like some people they do it in the office, and I do mine at surgical center, so it costs a lot more, but it's safer.
What is a surgical center the same way as doing it inside the hospital?
Yes.
Oh.
They have
Okay.
that.
Okay, cool. Oh, I did have another question. About another weird procedure.
Okay.
The O shot.
Okay, I've done them.
What is really the O shot?
You have heard that Kim Kardashian had the vampire facelift, right? The plasma.
Yes.
What they did, they draw blood, and they spin the blood, and they harvest the platelet or the plasma.
Okay.
The platelet is what stimulates growth. So you inject the plasma into the face, so it stimulates growth of collagen, tissue, increase blood supply, so it gives you a glow, younger, healthier look. So this guy said, why not try it on the O shot, on the clitoris and the vaginal
it's on the
wall.
clitoris.
Yeah. So basically, he takes the plasma, you injected the clitoris, you injected the vaginal canal, the wall, to increase more nerve supply, increase sensation. And but a lot of people claim that it worked great for urinary incontinence. You know what that is?
No.
Women who have given birth. Okay.
Okay.
So when they cough or they sneeze or they
Oh, they
laugh,
pee.
Oh, they pee.
urine leaks out. So it worked great. I did it for my sister-in-law too. My sister-in-law had it, and it get rid of that.
Does that mean it also tightens your vagina?
Not really. It just tightened the. So they claim that it helped increase stimulation, sensation. They have better sex.
Oh.
But
So I thought the O shot was, I saw it, I don't remember where I saw it, and it was supposed to be like a Botox shot in like your G spot or somewhere in there to increase orgasms.
yeah, but not because the G spot nobody can find it. Nobody know exactly where it is. It's
Okay.
So the area where you have the most sensation is your clitoris.
So you put they would put Botox
Plasma,
in,
not
plasma, not
the
Botox.
platelet. The theory behind that is that the platelets stimulate growth. They release all these growth factor hormones to stimulate this nerve endings, and it's supposed to increase
This whole time I
sensation.
thought they were putting Botox in the vagina. I swear I read that somewhere.
I think I want the O shot though.
Yeah.
Let's get the O shot.
Yeah.
But I had a C-section, so I don't pee when I sneeze. You pee when you
No,
sneeze?
not for that. For the better sensation.
Sensation,
Oh.
yeah.
Yeah.
How does
So some women, like, I went for the course like 5-6 years ago to the guy who supposedly invented it. So I went somewhere in
nice.
Alabama.
Very good.
And I talked to some of the women, plastic surgeon or women who had it done. And they said it worked. It worked for urinary incontinence, whether it worked for the sexual stimulation. I
The
really
sexual
can't say.
stimulation is like a side effect of it.
Yeah.
Can they do that
it
to
takes time.
men?
They do it for the penis, but it worked 50-50. I think.
Oh,
50%
very
how it works,
cool.
50, that's what I know. So.
What about
For men, it's only increased in the girth, the thickness, but not the length.
Oh,
Yeah.
wait, the O shot does that? The plasma stuff?
Yeah,
It makes him thicker.
thicker. Yeah,
That's what we need. Thick, not long.
exactly.
What about, has anyone ever come to you to try to get like butt injections reversed? Is that even
Oh
possible?
yeah. Actually, I had a consultation. A guy, he had it done in Miami.
Wait, a guy?
Yeah, he had it done. And
Was
it
he
just,
like a transgender or something?
No, he just.
Oh.
I'm not sure, but it
Okay.
his butt was like really messed up, lumpy bump.
But was it fat though, or was
No,
it
like
silicone?
Silicone.
Yeah.
Yeah. And he had it done removed, and he's not happy. So
So how do you remove it?
you suck it out. It's hard, but you can. I had a guy in New York. He did it like a year ago, and he's absolutely happy. He's absolutely with it.
With the
But he
removal
wanted-
of it?
Yeah, with the result of what I've done. But he wanted to come back to do a little bit more.
Oh, you removed it.
Yes, I removed
Oh,
it.
okay.
Yeah.
So,
So
but it's
you can
hard.
do it, it's just kind of difficult.
Yeah, but no, it can be done. But you just have to know where to go, what to do.
And once you take it out, can you put fat in?
Yeah. But he
Oh.
didn't want to be big anymore. Like a lot of people want big, they want small. You know,
Yeah.
like Pamela Anderson, they want big and small breasts.
Yeah.
And the same with the butt.
We have a question. What can you inject to get rid of dark circles?
It's very hard, but it depends. If you have dark circle because you have not enough tissue, like sunken in, like your eye have hollows, then you put collagen to fill out that so it looks so you don't have the dark circle. But from pigmentation, then what you can do is different kind of creams, like
Bleach it.
Yeah, bleaching cream.
Like you bleach your butt?
Exactly.
The same thing that you bleach your butt with?
Exactly.
Do you do butt bleaching?
No.
Oh.
I have a friend of mine. He does it himself. He got it online and he always talk about it.
Yes, we were talking about it earlier. We want to bleach our butts.
I bleached
Well,
mine
she did
already.
it.
Yeah.
But they got back.
It's getting back darker.
Yeah.
Yeah, it's something that you have to like
Yeah,
keep
do it all
going.
the time.
To
Yeah,
maintain.
exactly.
Oh, like Botox.
Yeah.
Okay, cool.
So yeah, I was gonna ask about penis implants, but I guess that's
I don't do that.
already
Yeah, that's done by urologists. But yeah.
Oh, okay.
Oh, you
Yeah.
know what? Oh, that's a urologist question too. Vasectomies. Are they really reversible?
Yeah. It can be.
That's not considered plastic surgery. That's
Yeah.
just
No.
Yeah.
birth control.
Would you ever turn down a patient?
All the time if I think they're crazy. Yeah.
Oh,
Yeah.
Crazy how?
like meaning they've done too
No,
much.
they just like unrealistic expectation. Like So
Oh, okay.
yeah. Like I said, I'm not the person for you. So
Yeah.
And they just got to deal with it. Favorite procedure to do?
Body
Tummy
count.
tuck.
Oh,
Tummy tuck?
Yeah,
Tummy
you told us
tuck.
That's why you're the best.
Yeah.
So the tummy tuck. Okay.
What's the person that you get like the most requests to look like?
Not really. Sometimes they want to look like Kim Kardashian,
Yeah.
but the younger they want to look like Kylie.
Oh, okay.
Okay, I gotta show you the picture of this lady. Okay, she's 71. Initially, she came in because she wanted her face done because she had an abusive husband or something like that.
He beat her up?
Yeah, or she was shot. He shot her in the face or something. So I did her face, and she looked absolutely amazing. Then several months later, she said she wanted a tummy tuck, and her family said no. Her doctor said no, and she said, "I don't care. I want a tummy tuck. If I die pretty." She wanted it. But finally, she got her doctor clear her, and I did her tummy tuck, and this is what she looked like today.
And she's 71.
She's 71.
I cannot wait to see this picture.
70. I want to look. Oh, I saw you post this.
Yeah.
I was like, her skin. Girl, look at her skin. It looks just like his.
This lady is not 71.
71.
So what did you do to
71.
her face?
I did a facelift with the plasma, the vampire facelift fat graft, and then I did
Wow.
a tummy tuck.
I'm gonna look at her again.
I'll show you a picture of her tummy.
Oh,
I'll
yeah,
find it.
thanks. My skin.
She's
looks-
71. People can't believe she's
I
71.
cannot
No,
believe
she looks like she's in her
71.
40s.
I cannot believe it.
Maybe like
That
50s.
is amazing.
Yeah, I have to find her abdomen. Her abdomen, like I said, nobody can beat me in it.
Do they do illegal butt shots here in Orlando?
They're done under the table, yes, but not.
Yeah, like fix a flat and all that.
No, not fix a flat.
No, they do,
That's but
right?
that's like the
Really bad.
yeah,
Is it-
yeah, not medical doctors.
Oh no,
Yeah, they're like
definitely not.
these are like I don't know.
Just regular people in the basement.
Yes,
Like Cardi B. Cardi B went to a basement and she
Yeah.
loves it
she
though.
did. Yeah, Cardi
Yeah.
B. Yeah, see a lot of people had done, but
Cardi B went to a basement, and when she went for the second time, did you read it in the
She
article?
said the person had died.
The lady that did him was in jail because somebody died on the table.
Oh my god.
Yeah.
So, but she says she's happy with her ass.
Yeah.
I don't know if she's lying or not.
She
Yeah.
did say that sometimes she has pain though. It was in a different interview. It was in her first.
But I heard
episode.
what's
wow.
her name? Nicki Minaj had them done too.
Oh,
Nicki
for
Minaj
sure,
ha-
for sure.
Illegal or legal? You think?
Probably illegal
yeah.
at first, at least at first.
I think that Kimberly lady that had been to the Breakfast Club
Probably.
hinted. She wouldn't say, but she hinted towards the fact that she did Nicki Minaj and other big artists that she had
Exactly.
done. She went to jail for about 3 years.
Yeah.
Oh, you know what? You didn't show him Joy.
Oh yeah, because I couldn't find like a good pic. Like she doesn't have any before pictures, so he was like comparing before and after pictures.
So while we're talking about getting the procedures we've had done, I don't know if Ayana's eavesdropping because since I got them done when I was 22, and I always told her that my boobs just grew. Boobs grow when you're 22. I've been lying to her ever since. She found my little card with the serial numbers one time, and I'm like, I just went for a consultation. Stop being nosy. She's been asking for the past year, so if she's listening right now from her room,
Yeah.
oh, we're gonna have a conversation after this podcast.
I don't know if Michaela knows. I don't know.
But this one is so. She'd be like, "Let me touch." I don't think they're real, and I'm like, "Well, they are, all mine." So I've been lying to her this whole time. Oh well. So you make sure that they look. Well, there's some that like their breasts
To look fake.
to look
Well,
fake.
that's why sometimes I ask, like, how do you want to look? Because sometimes women don't know what they want.
Right.
They may think they want natural, but they want to look like porn star.
Yeah, my friend went in and
yeah.
specifically said, "I want
I love
porn
that
star
porn star."
titties, and I want a lot of under boob."
Yeah.
Oh,
Yeah. So
you can make underboob. Oh, like make it the low profile ones, I guess.
What do you mean?
She's just like where you can wear like a certain type of shirt and like you
Yeah,
have like
have
a
it low,
yeah,
yeah.
exactly.
Oh, so they're just hanging a little bit.
I wouldn't say hanging. I don't know how
Just
to
like-
describe it.
like like heavy, like
Yeah.
round.
Oh, okay.
Yeah.
Ooh, no, I
Like-
want it natural.
Yeah, because perfect, like breasts are not supposed to be perfectly round, like two balloons, like two balls on your chest.
Yeah, no.
Yeah.
So we have some listener letters.
Okay.
So I have one girl that came and she just had her lips done and her breasts done. So I thought she was done, right? But she said, "Oh no, girl, I'm getting something else done." So I said, "Go ahead and shoot me a message about what you have done." She says, "Got my boobs done a week ago and I love them." We do too, girl. We do too. Got them done because I have 2 kids, breastfed, and my tits look so sad. I gave them life. Getting lipo and BBL next month because I have good credit, and fuck it, why not? I'm a healthy person. I love working out, but I haven't gotten the results for my belly and my ass, so I'm going to cheat a little and then maintain. I'm not nervous because I am fit. I don't have much fat anyways. Most women that do surgery don't work out a day in their life and then want to lie about getting surgery. I'm excited about it and no, it's not much that needs to be done, so I can't wait. I'll be 31 this summer and I don't want any more kids. She touched on something that is my thing. Are there certain things that you can do with lipo that you cannot do working out?
Correct. You can't spot reduce no matter how much you work out.
What does that mean?
Like, for example, you want to get rid of your love handles. You can't exercise your love handles away.
Like there's this,
Let me
for
stand up,
example,
hold on.
No, look, this is an example. There's this girl I know. She has a big butt, right? She's not a big girl, but she has some booty, and she's like, I don't want to lose my butt in the process of working out, but she will have to because she has to lose weight in general.
Squared as hell.
Yeah.
My daddy.
Okay.
Look at this.
And you have 2 babies?
One.
One. Yeah. Yeah.
This.
You can't get rid of that by no matter how much you exercise. You lose your butt, you lose your breast, you lose overall. So
Yeah,
Well, my
you have
breast ain't
to
going
lose-
nowhere.
you have to lose overall weight.
Oh man.
Yeah.
So I would have to get really, really skinny.
yeah. So lipo would get rid.
I can get
rid
lipo?
2 or
I'm
3.
enough?
Yeah, of your love handle, you would lose 2 or 3 inches of your love handle. Boom, right away.
But the invasive lipo.
No.
Does
you can do it
non-invasive
on the
lipo
local.
work?
No, the cold sculpting, to me personally, if you
Yeah.
want my honest opinion, I
Yes,
think
you're
it's shit.
honest.
That's very good marketing.
Yeah.
Good advertising. But I personally know like 6, 7 people who pay thousands and thousands and thousands of dollars, and it doesn't do shit.
So listen,
Wow.
guys, from Doc, that cool sculpting, because I think they have a billboard around here in Orlando
they're
somewhere.
everywhere.
They're everywhere.
They're very good. They try to sell me the machine, and I said, "Listen, remember that Chinese girl I showed you the picture of?
Yes,
her?
yes.
Her dad pays $7,500 for her abdomen, blah blah blah, because his friend did it, and he did it, and he said it doesn't do shit. It's a waste of money.
Wow.
Wow.
And when you go back, you can't complain. They're not going to give you your money back.
Right.
I thought
So-
about doing it too.
And I have another friend. He won it in a group, like a contest or something, that they give you like a package, but then he still have to pay another $500. And he did it, and it doesn't do anything. It's like no change.
So I would have to get lipo.
The only way to get rid of fat cells is to physically remove it.
But
right?
if, like you said, if I only do it from here, then I'm
Yeah.
going to gain weight somewhere else.
No, if you gain
If
weight,
I gain
yeah,
weight.
if you maintain, it won't.
Okay, so here's one more. It says, "Hey girls, here's my experience. I've got lipo twice. First time I was really young and seriously did not need it, but I was obsessed with getting it. I was like 18 or 19. Do you operate on people that young?
Yeah,
Oh, wow.
18 is the age of consent. They can consent.
Oh, wow. She says, worst idea ever. Did not research, did not dig in on which doctor was doing it, did not look into post-op care, which I would say is definitely the most important part besides the doctor was
Correct.
doing it. On my first experience, the doctor never told me I needed to get lots of massages, so I
Yes.
didn't. And I stopped wearing my undergarment 3 weeks after surgery and wore jeans and tight stuff. So you're not supposed to wear tight clothes?
No, because it can cut into you, and it could cause indentation.
Oh, okay. That left me with fibrosis and a
Yeah.
crease
Yes,
where the jeans
big
button was,
crease,
and
yeah.
it wouldn't go away. So a few years ago, I got lipo again to try to correct it, and because of this time around, I needed it. I went to Colombia, researched my doctor, took everything that I had to do to get the best results. Best decision ever. Result-wise is much better because doctors in Colombia are experts at sculpting. Dr. Pham is an expert at sculpting too.
He's right here now.
He's right here in Orlando. Here in the U.S. are not good at sculpting. Yes, he is. Plus, they charge per area. Oh, so you guys charge per area here?
Correct.
Okay, over there, she paid $4,000 for her whole body being lipo.
Wow.
That's less than boobs.
Yeah. That's less than I paid for my boobs.
Yeah, that's less than I paid for my boobs too. I paid
Yeah.
$4,500.
I paid $53.
Holy cow! Well, mine was $5,000. He gave me a $500 discount because I paid cash. My daddy did. My sponsor. Shout out to my daddy up in heaven. He said, take the cash. Colombia. Here's the most important thing to do in the doctors in Colombia. It's post-op care. Every single surgeon in Colombia includes at least 10 post-op draining massages. Do they include that here?
Yeah, they can include in the package.
Oh, in a package? Yeah. Okay. If you don't do this, you get hard spots and fibrosis. You don't need to use an undergarment. Let me see. Some doctors don't understand how important this is why I'm happy to go to Colombia. Besides lipo, she's gotten breast implants, fillers on her lips, and last year when she turned 30, she tried Botox on her forehead for the first time. I was panicking about turning 30. I did too. I didn't need it, but the doctor said it's also preventative, so I said, why not? Overall, it's been a good experience. Now with the fillers, you have to be careful. Some girls get fucked up lips. And she goes, oh my God, I just came to the realization that I'm half plastic. Let's not get into hair because half of mine isn't mine. Neither is mine. But praise God for all the alternative solutions. Thanks, Lo, for sending your experience. Wow, lipo twice.
Wow.
That's
what do you think about that? Is that common for people to do it more than once, or?
Yeah, sometimes they come back for a touch up. Like they do it and then they over like 2 or 3 years and they gain a little bit, and so they come back for a little touch up. So it's normal.
So how do you get rid of those hard spots? I remember I saw a girl who got an NDR and her back was hard and lumpy.
Yeah, that's why you have to do the massages.
And what do you do when that happens? Do they go away?
You can try to go back and smooth it out with the certain spot
with lipo.
Yeah.
Oh.
Yeah.
Yikes.
Or you can inject collagens or what have you into those areas.
Wow, that screwed up the whole first work. Yeah. Okay.
All right, you guys. So now it's time for our segment with a little unsolicited advice. So since we have the doctor here, do you have any advice for anyone who's looking to get plastic surgery anytime soon?
The best thing to do is, because I have a lot of my patients through referrals. So if you know somebody who had done and they're happy, and that would be the best source of info, because
because they've done it.
They've done it. They know it.
What about that website? Do you know the one that
Real Self? Are you on Real Self?
I'm not sure what that is.
It's like basically like a social media site, but strictly for plastic surgery. So people share experiences about their doctor. They talk about recovery houses. Some doctors are on there and actually answer questions. Yeah. So that's actually a really good place to do research, right? Real Self.
But definitely.
Because if you don't personally know anyone who's had it, those girls, they post pictures pre and post-op.
Because my patient, most of them are Spanish, so they talk about it. They brag about it.
Oh, we tell everybody.
No, I know. Like I have this one lady, she's Cuban, she's a hairstylist in Altamont, and she
sends you a bunch of
people?
Do you give her like a free facial every once in a while?
No, she just did it because she wanted to. So
that's cool.
Yeah.
That's awesome.
I know.
So because of what's been going on lately, we're gonna go into our next segment, which is
a little
shit talk. So I have a bone to pick with men, but not the cheaters, but not just the men who cheat. The ones who cheat on their very, very pregnant girlfriends.
Oh.
Do you know why I'm talking about this? Yeah. We've heard this story what feels like way too often now. Kevin Hart cheated on Anika when she was pregnant.
Yeah.
Tristan Thompson on his first baby mama. And today, or yesterday, we found out that he was cheating on Chloe, his new baby mama. Mm-hmm. The Dream, cheated on Christina Milian. Eddie Murphy on Mel B when she was 4 months pregnant. Wendy Williams revealed that in 2001 she was pregnant with her son, and she got cheated by her husband, Kevin. Lauren London and Lil Wayne when she was pregnant, and he also had Navia pregnant. I forgot about her.
At the same time?
At the same time.
That's so messy.
Lauryn Hill got cheated on by Rohan Marley. I can't fathom why they can keep their thing in their pants for 9 months. We sit at home, get fat, get our feet swollen, our noses get fat, we get stretch marks on our ass, on our stomach, and our arms, gain tons of weight, they have to work overtime to get fit again, or go to Dr. Pham and spend a whole bunch of money to get a tummy tuck, while you guys are out here being dogs and sticking your thing into anything. You know what I want while I'm pregnant? If I ever get pregnant again, buy a oops, because I will not do it by choice. I want you to eat with me, get fat with me, not too much because then I'm not going to like you. I want you to simply not go looking for new ass while I'm at home getting fat, creating and feeding your child inside of me. So for all the man who can't keep it in your pants, I hope to God you get a nasty STD. I'm not going to hope that you die or anything like that, but a curable one that creates pus and pain and keeps you from using your penis again for a long time.
But if you do get cheated on while you're pregnant, you can always go to Dr. Pham and get a mummy makeover afterwards and then slay it.
And make him regret everything he did.
Exactly.
Yeah.
That's our show for today.
That is our show.
Thank you so much for coming.
Yes, it was awesome. I learned a lot.
I learned so much. Thank you so much.
You know what I learned?
What?
I don't need to be going to the gym no more. Because the shit ain't going nowhere. I'm over here killing my ass in the gym, and I'm going to stay the same way I am, squared as fuck.
I learned that if you are going to do anything, you definitely need to do your research. And I learned that I want to research that old thing to see about getting it myself.
I might get me a little lipo one day. I'm scared of it though, but I might try to get my little lip things.
Thank you guys so much for listening.
Thank you so much. Bye.
Bye.